Good afternoon, everyone. My name is Peter Meredith, and welcome to today's webinar. We are demonstrating a new HIPAA solution that is powered by our partnership with Abyde. At Tech Eagles, we have helped medical offices with IT for many, many years. And over those years, we have noticed a few key frustrations that practices have with HIPAA compliance. First is that HIPAA is confusing and complicated. Second is that HIPAA takes too much time. And finally, practices have no assurance that they have done HIPAA correctly. Of the many solutions we've looked at throughout the years, they often solve some of these problems, but Abyde has a solution for you today that solves all of these problems and more. So during the demonstration, if you have any questions for us, you can post those in the chat and we'll wrap back up at the end and answer as many as we can. So I want to introduce you guys before we start with the demo, Chris from Abyde. He's going to share a little bit about their mission and how they got started.
Thanks, Peter. Pleasure to be here. My name is Chris Wheaton. I'm the Chief Revenue Officer at Abyde. Abyde is a technology company comprised of HIPAA and OSHA experts, and all day, every day, we provide education and solutions to the independent practice environment across the country. Since 2016, we've been revolutionizing compliance with our easy-to-use software, which y'all are going to see here in a minute. But we're really just proud of carrying out the message as a partner of Tech Eagles and really helping their customers and future customers get compliant the easiest way possible. So thanks again for having me, and thanks for joining today's webinar.
Yeah, thank you, Chris. And could I ask, is there any reason why medical practices should take a look at their HIPAA compliance now? Anything happened recently?
Yeah, there's been a lot of news. Change Healthcare is one of those big news clips that people probably have heard about, especially in the dental space. But the proactive audit campaign coming back, the government has actually come back from a 5-year hiatus from their proactive audits. So recently, the OCR director announced that they are going to reignite their proactive audit campaign because they've, quite frankly, identified that practices are not doing what they need to be doing with the security rule and, of course, the privacy rule. So over the last 5 years, there's been a lot of action when it comes to initiatives by the government, patient right of access initiative, responding to breaches, large and small. But now the security rule and that security risk analysis initiative is going to be a main focus for enforcement. So now is a better time than ever to get educated on what's required and ultimately implement an action plan and document what your compliance program looks like.
Yeah, wow. So let me just say it again and make sure I got this right. So for the past 5 years, the government has only been doing audits from whistleblowers. Maybe that's an employee, maybe that's a patient. But now they've relaunched this proactive audit campaign, so they could audit you even without a whistleblower.
Exactly. Yeah. Over the last 5 years, the patient complaints have been rising. So they've been responding to a lot of those. 30,000 plus a year. And then, of course, data breaches. It's all public. It's right on their OCR data breach website. So I think the goal is to start holding practices more accountable more quickly. They've also, recently announced that they've had their first ever ransomware fine and phishing fine. So again, just a great time to get educated, because if the government sends, an independent practice a letter and you're part of that practice, you want to know what you need to be doing to comply with those federal and state laws.
Yeah, and one of the things we've noticed too is, this HIPAA security rule, it's 20 years old. It's not technology specific, so they're really going to bear down hard on this. And it looks like too that there's going to be some changes too coming to the HIPAA security rule. Yep. So we throw around this compliance, and how about we look at a little definition of compliance? We know the government has a definition, but how do you guys see it at Abyde?
Yeah, we feel pretty confidently that most practices we speak to, large and small, most practices we educate, have a culture of compliance, right? They're trying to protect data. Data is such an important part of their day-to-day operations. Obviously, they're providing patient care, they're running a business, but the data is so valuable. So protecting that data is as valuable, right? You got to protect the data. So how we define it is documented proof that there's a culture of compliance within your organization, because the government's not going to take your word for it. And just like taxes, right? If you get a audit letter from the IRS, they're not going to just take it. They're going to want to see receipts. They're going to want to see documentation. So same thing goes with compliance from the OCR, Office of Civil Rights, or a state attorney, or if you're attesting to MIPS with the Center for Medicaid and Medicare Services, just know that the documented proof that you have a culture of compliance is often what's going to fall through the cracks. So making sure you get educated on what's required and then ultimately implementing that solution is vital.
Yeah, absolutely. Not only do you have to have the security in place, you actually have to have the documentation that supports that you're doing that you're doing the training, that you're implementing those controls. So how does Abyde compare to other methods or practices that a medical office could implement a HIPAA program?
Yeah, I mean, there's many different ways to get it done, right? Like we're not the only option in town. I would argue that we're the easiest, most cost effective, just because the software is so intuitive, and we've really just made it our mission to make it approachable, easy, something that you actually want to get done. So yeah, you could use an array of different tools and options: the government tool, a consultant, other softwares, or tools that you can hopefully streamline the process. But we say this respectfully, but we've done the research. It's literally impossible to do it as cost effectively or as time efficiently without Abyde. So like Abyde's the easiest, most cost effective way to do that. And we're really proud of what we've got going on, and appreciate y'all helping spread the word on this.
Yeah, absolutely. And through all the different solutions we've looked at, there's always some trade-off. Is it putting more work on you to do all of the stuff yourself, or is it costing more to have an expert do this for you? But Abyde has really hit that niche of being both cost effective and time effective, and then also you have assurance that you're doing it right.
Absolutely.
So I'll turn it over to TJ here. He's going to demo the product for you and some of those key features that we at Tech Eagles and our clients have noticed that really save a lot of time.
Thank you, Peter, and thank you, Chris. So what I'm going to be showing you all today is I'm just going to show you the actual Abyde program and how you actually work through it. It is a demo environment, so keep that in mind. So we're going to fast forward a little bit through some of it, but I want to show you a couple of things about the program that kind of blew our minds and some of our clients when we started using Abyde. So one way to keep a documented proof so that you can show your culture of compliance is through the security risk analysis. It's one of the first things an auditor will look and ask is if you actually have an analysis done. And doing those can be very daunting and complicated and really confusing at times. And they ask questions that you have no idea why they're asking or what they're even for. So typically in Abyde, the first time you come through and look at this actual program, you will have already went through their client success partnership, and they will go through and walk you through how to sign up and get all this started. So that's why right here beside security risk analysis, you see it's already completed. We've already done that. So if you will, imagine with me, we have not done that, and we're going to skip down to ongoing compliance so I can show you what these actual SRA questions look like and what they would look like as you're answering them. So this is pretty much what a question would look like when you're taking an Abyde SRA analysis. One, you're going to see what kind of safeguard is this? Is it administrative? Is it technical? What is it? You're going to see the section of HIPAA that it actually applies to, why this is important. So you can look that up if you really need to. And then it's going to ask you your question and tell you, is this high risk, moderate risk, very high risk? So this one says your scorecard indicates your organization is unsure how often workforce access is reviewed. How often is workforce member access reviewed and if necessary updated? So they give you a couple of ways to respond here. Most questions are yes, no, or don't know. The most important thing when answering any of these is answer appropriately. If you really don't know, click don't know. And you can move on. If there's a special note you need to add, you can do it in there and you will go next. Does the antivirus software contain automatic updates? Yes. And if you want to be super sure, you can be like, updates every night at 1 a.m. and it will save that on there as well. So that's pretty much, you'll go through the entire security risk analysis. And when it's complete, you will find it under the security risk analysis scorecard. From here, we can review all your questions, how you answered them. And what makes this so easy, because you as a practice manager may not know all the answers to all these questions. You can actually go in here and say, hey, I want to look at all the technical ones because I don't know this stuff. I need to talk to our IT, which is hopefully us at Tech Eagles. If not, we can help you out with that. But we can go through and review these together and answer those and get those on there. What's nice, though, we talked about we wanted documented proof of ongoing compliance and that culture. We can view history and see every time this has been updated, because that's going to be one of the big things an auditor wants to see, is that you are working toward compliance and actually working on that. So that's how easy it is. Go through, click buttons, answer them, go about your life on that. So the next part of HIPAA that really confuses a lot of people sometimes is the documents and procedures and policies that you're supposed to have in place. And you may know you need like a disaster recovery plan, but do you know what all HIPAA wants you to have on it? Is it just fire safety, or is it antivirus or breach or ransomware or all this stuff? So there's a lot of policies and documents things that are really difficult to create and get them going. So I want to show just the disaster recovery plan one from Abyde in here today and show you how easy it is to create. So they actually have a section for this because of how important it is to your HIPAA compliance. So we're going to click on that particular section and we're going to create this, and you're going to be amazed. All the magic. So it's got a few sections of questions that you're going to go through and answer. So first one, local first responders. We want to put in our police department, fire department, ambulance service. You want to put that in there. Put in your important ones in there. Same thing with your vendors, who your alarm system is, your landlord, your EHR software contacts, your IT vendor. Once again, hopefully us at Tech Eagles. So yeah, we're going to keep saying it. Got to. Your emergency roles and responsibilities. Who in your company is responsible for communication to the media? Who is the one who's responsible for communicating to authorities? Your vulnerability to different things, malicious software, earthquake, public health emergencies. So once you're done filling out all that information, which is not a lot, you'd hit submit. At that point, we're going to go back to the dashboard. We're going to go to policies and procedures. You got 3 good sections here: procedures, policies, and forms. These are all in there for you that Abyde has curated that can take the place of things that you may need for your HIPAA compliance. Like I said, we're talking about disaster recovery. I can download that. And what you're going to get here, let's go back up to the top, is a full-blown document that has everything that you need to be HIPAA compliant for a disaster recovery. It's going to have your purpose, your policies, the definition of a disaster, your threat, your vulnerability, how much it would impact your business, all the way from fire, all this stuff, all the way down through there. It's going to have all the contacts listed in it that you need. You don't have to look them up for all your vendors, police. It's going to have a list of all your employees and their contact information to contact them to make sure everybody's safe, who to contact in what kind of situation. There are companies that specialize in making documents like this that charge you an arm and a leg, and you get that for answering a few simple questions with Abyde, and it's very easy, very professional, and will look better than about anything you can find anywhere out there. So it's absolutely amazing. So one more really easy one, and this is one of my favorite ones. Part of your HIPAA compliance is that you have to have your business associate agreements on file, and you have to have those with everybody that you interact with that may come into contact with patient data and so forth, anything else. Those are a hassle, one of them all. I want to show you in real time here how to do that entire thing, so that we make sure you see how easy it is, because this has made our lives as an IT company super easy. We're going to go down to the business associate portal. We're going to click on that sucker. I'm going to click the plus to add a new vendor in here, add a new one. This one last time, this one's going to be Frank's Place. Pop in his email, his phone number, no expiration date. We're going to hit submit. From this point, I can click send over here on the business associate agreement. We have 3 options. I can link to a BAA on a vendor site. I can upload an existing one that I may have already made, or the preferred method, just use Abyde's because it's wonderful. Once we click on that, we are now going to we're going to decide who we're sending it from. Is it your general manager, your practice manager, who's sending this one? So John Snow is going to be sending this one out. He's going to send the email. So it says it's sent. So now we play the waiting game of how long it takes to get to our inbox. It's instant, as you see that. So my client now has that BAA. It's going to tell them all the information while they're getting it in compliance with federal regulations. I'm going to be able to click on this agreement. It's going to give me more of the terms and why I'm looking at this and what I have to do it and who it's with. Going to click start. It's going to give me all 13 pages that I can read through what all this is and why I'm getting it. We'll go ahead and get next. We're going to enter our address. This time it is going to be from good old Batman. So y'all are just going to have to stick with it. I'm a Batman nerd. We'll put in his information. Next, I'm going to put in my name. If I can spell. And he is not Batman. Nobody knows that. We'll go next. It's going to give me a chance to review the document again with the signatures in place. So we'll look down through here. Go all the way to the bottom. It's the same document, but now we have both my company's information and my clients that they actually filled it out. At that point, we'll hit complete. And two things happen when it's complete. Number one, me as a practice manager, I can go back into the portal. I can refresh, and I can now see that Frank's Place has signed this. And I can click it and download it and view it. At the same time, Frank and them, they will also get an email that gives them the NPP. They can review all that stuff as well. And you can do that with as many of your BAAs that you need. It is that simple to do. So just going along with the theme of simplicity, Peter, do you want to talk a little bit about how big of a hassle it is to normally get your employees to log into a portal and take their training and everything else and all that fun stuff?
Yeah, one of the challenges and time-consuming things that we've found with HIPAA is just managing all your employees to do their training. You know, you got to contact them, you got to track their training, you got to keep a file of all their certificates, and then you got to do that every year. But with Abyde, they have a really powerful solution that makes it super easy. TJ's going to show you guys how that works. He's going to walk you through literally exactly what you do. And in the time it takes him to do it, it'll take you as much, if not faster, to do it yourself. So yep. He'll show you what that looks like.
All right, so we're back here at the Abyde website. This is where I log in as a practice manager, but you also see down here at the bottom, log into your employee portal. Before we go there, I do want to point out one more important thing, though. Abyde does not only do HIPAA for covered entities, they also do it for business associates, and they also do OSHA as well. I cannot say OSHA today, people. It's one of those things. It's one of my words, but there it is. So we select the one that we're in. We're a covered entity at this point. We're going to log into the employee portal, and we're going to shoot that email over. It's going to send me a code to log in. While we're waiting a second on that code to come in, I also want to show you this. It's my phone, same website, really blurry. This works on your phone for your employees. They can log in there super easy. They just have to have access to their email, as we have here. We're going to get our code, 6308. Log in. That's how easy it is. They don't have to remember a password. They don't have to store anything. They just need to know the website to get to, their email address that they signed up with, and log in. From there, as you can see, we can see the location they're assigned to, who their HIPAA compliance officer or officers are. They can click those and see their login or their contact details. They can go in and review all of the policies and procedures of their company. So, hey, what's my multimedia policy for where I work? You can see it right there and what they're supposed to do. From there, the fun part is we can go into HIPAA training. It's only going to give them what they need when they need it. So new employee HIPAA compliance training, we click the video, we watch it, we answer the questions. We at Tech Eagles have reviewed a lot of these, and I will absolutely say without a doubt, Abyde is probably the most informative and easy to follow along with, and the only one so far that has not tried to put me to sleep, which is amazing. They're not corny or anything like that. They're straight to the point and informational, and do it in a way that captures your attention. But that is literally how easy they get in and do their training. So if I'm a manager or a practice manager back in the previous portal I was in, you would actually be able to go in and view when all your employees have trained and do all of that and just keep up with it as well. So at this point, we're going to bring back in Peter and Chris, and we're going to answer a few questions that we have, and we'll go through that route.
Yeah, thank you for that demo, TJ. I know Abyde does far more than TJ was able to show, but we'll get to some questions.
Yeah, I think the first one we're going to go to here, and this is a good one. I think, Chris, you'd probably be best for this, is how much time are you expecting for your HIPAA compliance officer to spend managing compliance?
Yeah, so the software is so intuitive, so easy. It actually tells the practice administrator or whoever's using Abyde, the HIPAA compliance officer, usually what to do and when to do it through notifications. We say about 10 to 15 minutes a month answering questions and keeping your profile up to date. Everything you need to pass an audit's waiting right there for you. So minimal time, and it's simple, but it's comprehensive.
Yeah, and I kind of showed a little bit of that off too, because we had already completed our SRA, so I showed you the ongoing compliance section. And what you'll get email reminders once a month to go in and review some of those steps that you need to take. And that ongoing compliance is one of those. So that's what it would look like. You literally pop in there, you answer a few questions, you've done kind of your managing of your compliance for that month, so to say. It's an ongoing thing, but inside the portal, that's what you would go with. We got two good questions here. I'm going to lump those together. I'll show you the first one, then we'll cover the second one and then circle back. So the first one is, what do you do if you get audited? And before we actually show that, I think this next one's a little bit more important to it, is, has Abyde helped pass any HIPAA compliance audits and investigations?
Yeah, absolutely. What good's a compliance software if doesn't help you pass an audit? So we passed dozens and dozens of audits over the last 7 years, and we're proud to say we're batting 1,000 with passing those audits. Not one of our customers ever paying a dime to the government or having corrective action, and that could be a federal audit from the OCR or Center for Medicaid and Medicare Services or a state attorney, and it's really just all hands on deck. So if and when you do get that audit letter, it's usually emailed or mailed to you. You just go into the software and click that red button that TJ will probably show here in a second, and it's all hands on deck here at Abyde. And we're just really, really proud of our customer success team and the white glove service we're going to be providing throughout time as an Abyde user.
Yep. So to mention what Chris was talking about, if I get audited and I'm in the Abyde platform, I'm going to log in as quick as I can. First of all, if I see an auditor walk through the door, I'm going to come up to the gear in the top right corner and I'm going to hit this help button there. I know Chris and the guys, I still want them to add a siren to it that visibly sounds whenever you hit activate, flash the screen red, go ahead and get you scared and get your heart pumping. So, but I mean, that's it. Like I said, you hit the activate button, they're on it, or you can call them directly. The phone number's right there and they will jump on it and start helping you. So absolutely. So
yeah, the other thing I'd add there is there's no hidden fees or extra costs. So that is included with the software.
Yep. Absolutely. So another one here that I'll just hit really quick. What should I do if an employee leaves my practice? One, of course, you'll go through your offboarding as you do with everything, make sure all the IT stuff's taken care of. And that, as far as Abyde is concerned, you'll go through and deactivate them in the portal. But Abyde has same place up where that emergency button was. There's something called A Drive. And that's going to store historical records of employee trainings, what they have done, all the notices they've signed, all that stuff. It's all stored there for you because you are required by HIPAA to keep those for so long, and it's going to keep them stored in there for you. It also allows you to upload, let's say, previous SRAs from your previous HIPAA vendor that's not working out and you want to jump over to Abyde. So, we can help you get those uploaded in there so you have those for historical as well. So one other question here, and then I'll check chat again to see what else we got here. Chris, doesn't my practice need a physical HIPAA manual? One of the real big folder books that you can just throw to an auditor and hopefully knock them out on the way through the doors. So, but yeah.
Yeah, I think it's a common misconception that people just, hey, I have my HIPAA manual, I'm good, I don't need to do anything. It's, hey, what's on the inside of that manual? Is it up to date? Is it accurate? Is there a security risk analysis in there? But it's not a requirement to have a physical form or physical copy of this. So we actually recommend it to be an electronic form because every audit we've ever passed, they request you to share your HIPAA documentation electronically. And really, a HIPAA manual is just a place to store and have easy access to HIPAA related documentation. So that's why the employee portal is so vital, and that ongoing compliance aspect, because as the practice is answering questions, keeping the profile up to date, adding or removing employees, all the policy and procedures change, and it shows version control, and there's a historical snapshot. So again, if you're printing that out, obviously you're allowed to do that, but how are you going to update that and keep it active? And Abyde's figured out the best way to do that is just using our software appropriately. So yeah, no requirement of having a physical manual. Highly recommended being in the cloud and electronic.
Awesome.
Yeah.
And just to go along with that real quick, we do have a question from someone in our StreamYard chat that's referring to those documents. And they asked, are these forms pre-made with HIPAA compliant content? So speaking on the documents and policies and stuff I showed there, Chris, can you talk about those for a moment?
Yeah. So policies, procedures, forms, everything that is required of a practice is there for you. They're not templates. They're actually going to be, if it's grayed out, it means that you're not doing something in the security risk analysis. So we're not just providing a bunch of templated documentation. So it's going to be all HIPAA related. But the great thing is it's going to be state specific, because Abyde takes your state into account with specific requirements like data breach notification or patient right of access requirements. And then also, your employees' information. So anybody that needs to be a part of a specific policy is going to be brought in from the employee section without you ever having to lift a finger. So yeah, it's all pre-made HIPAA compliant content is, I think, the question. So absolutely.
Yeah, and I'll touch on that too from an IT perspective, because we've helped with previous HIPAA vendors and programs before too. And obviously they would offer some kind of template or policy document and stuff too. But what sets Abyde apart and makes our lives easy, and you as a practice manager as well, they're not going to force all those documents and policies and procedures on you, and if they don't apply to you. So they figure that out through your SRA and the questions you answer and how you do that. And like Chris said, they would be grayed out. You can still see them, so you can request access to them if you do want them. But if they don't apply to you because of how you answered on your SRA, then you don't have to worry about wading through the nonsense. So the ones that are useful to you are there. For instance, there's a question, do you have a HIPAA compliance email signature? If you answer no to that, then you're in your policies and documents, you're going to see a template with a generalized HIPAA compliant statement that you can copy and start using immediately to go back and change that question to yes at that point, because then you do have that and you are compliant. So some of those are that easy to fix. So really great. So any last words of wisdom before we head out, Chris, that you want to say to the people?
No, I just really appreciate the opportunity for the partnership. And, it's important for us to have partners that, take HIPAA serious. As an IT company, MSP, y'all are on the front lines. You're helping protect these practices, but it's the documentation, again, that slips through the cracks. So just really appreciate the opportunity. Always here to educate and help, and hope we get to meet more of your customers and future customers.
Absolutely. Yeah. And I'll let Peter have the last word as we leave out of here. I was just going to make it a little clearer. You do not have to have Abyde to have Tech Eagles. You do not have to have Tech Eagles to have Abyde. But if you are someone who has to be HIPAA compliant, then you should. So, but we're not going to force either one onto you. It's up to you and what you think's best for your business. But, we work in a partnership with Abyde. And like I said, we viewed a lot throughout the years, and Abyde is by far the best and easiest, and Chris has said it too, cost effective out there for what you get. It blows my mind. It's made my job easier. It's made my team's job a lot easier as well. So I've absolutely loved it. So I just want to say thank you to everybody. I'm going to remove me and Chris and let Peter send you all off on the rest of your workday.
Yeah, absolutely. Thank you, TJ. And yeah, what TJ showed you, what his demo today, that's pretty much exactly the user experience that you'll have. Abyde, it literally takes 10, 15, 20 minutes a month to stay on top of all this documentation and all of these security questions. So the last thing I want to mention, though, is, Abyde, it's not just helping you with government paperwork and HIPAA compliance. HIPAA, it's designed and it's not intended to be a burden to your business. It's actually intended to protect your business. And implementing Abyde lowers your business risk, not only of an audit, but also for a cyber attack. So thank you all for being here. If you have any questions about Abyde, HIPAA compliance, or cybersecurity, just reach out to us. You can go to our website or reach out to Abyde. Thank you all.